Good evening and welcome to Feed Forward. My name is Chris Martin. I'm here with the Illinois Podiatric Medical Association. Welcome to the September issue of Feed Forward. We have a very special and local tie guest. It's fitting that we're here in Greektown with Dr. Stavros
Alexoplous.
Pronounced just like it sounds, right?
Exactly.
I don't know how I can't get that name right. Welcome to the show.
Thank you, Chris.
Born and bred here in Chicago,
Born
not
and
far
bred
from
in
the
Chicago.
studio.
Not
It's
far.
very exciting to kind of come back to the neighborhood and your roots, right?
That's true.
Good. For this show, we're going to be talking about two related things, heel pain and custom orthotics.
Okay.
Both very important for podiatric practice and for many patients with foot pain.
True.
But before we get into that, I want you to talk to our viewers a little bit about your trip that you made in 2008 to the Athens Olympics. And I think that was kind of cool. You told me right before we came on, we didn't really have time to plan for it, but I thought it'd be a cool thing to just kind of add as a little local flavor. And tell us a little about what you did, how you got to volunteer for that, and what was your role there?
What can I tell you? It was one of the greatest experiences of my life. I had the opportunity to be a volunteer podiatrist at the Athens 2004 Summer Olympics held in Athens, Greece. And there were only 3 podiatrists invited from the United States. Podiatry is a field of medicine that did not exist in Greece at the time. So they had to import these specialists from other parts of the world. So we were asked to go there from the United States. I had one interview when I was in Greece for an international sports medicine conference. Then I had a few more interviews over the phone. And it was really, really exciting to be selected because I knew I'd be able to use my skills as a podiatrist, something they don't have there. And the other thing that helped is that I'm fluent in 4 languages. I speak, in addition to English, I speak German, Spanish, and Greek fluently. And that helped me because I treated athletes from all parts of the world. And you know what's neat and so interesting? I found that even though these athletes were the cream of the crop, the best in their field, the greatest athletes from the world over, they all had the same problems that my patients in Chicago have.
Interesting.
So I was able to treat them and get them back on the field running, and the greatest joy was that 3 of my patients received gold medals. They were all members of the running team from Jamaica.
Really?
So that was a lot of fun. And I had one of them come back and bring us the gold medal, and we even took a picture together, and that was a
You're
lot
kidding.
of fun. Yeah, I loved it.
Did you put it on your website or anything like that?
No.
Oh, you got to do that. I got to see that picture.
Okay.
That'll be cool. So, what kinds of things did you learn there that you could take home for your Chicago patients? I mean, you said that there's some universal sort of diseases and problems that you have, but did you see anything new there that you could bring to your Chicago patients? Like, hey, I saw this problem in a Jamaica runner, and you got the same problem.
I learned one neat trick to help people with a pinched nerve in their foot, and I learned it from one of the United States volleyball players. He asked me, what do you know about pinched nerves in the feet, called a neuroma? And I gave him the 10-minute lecture, and he said, I know all that, but did you ever do this? And he took off his shoe and sock, and he took off this fancy little rubber band, and he showed it to me. He says, this is what I put around my toes. It takes the pinching off my nerve, and I don't have any pain.
A little rubber band.
A little rubber band, special thick rubber band. I learned that trick from him, and I've used it on my marathon runners here in Chicago.
And it works.
It helps a lot. Nothing is perfect, but it really helps.
That's a great homemade remedy.
The best homemade remedy. It didn't cost a dime.
We'll have to do another show on common foot care home remedies.
That's right.
I've been collecting those for years, so I've got a few too. We want to get right into the show now. We want to talk about heel pain and orthotics. They're kind of related, but let's divide them up so that it's easy to follow for our viewers. And by all means, if you have a question, please call 312-738-1060. And we'll be happy to answer your call. And we'll actually break into our regularly scheduled program to answer your question. Right, Sylvia? So let's talk about heel pain.
Sure.
Tell me about the common causes or the common categories of heel pain.
Fine. Heel pain is very common in the podiatrist's office. Perhaps 15 to 20 new patients that present to the average podiatrist's office in the United States suffer from one form or other of heel pain. Now, it could be from children to adults, although heel pain is much more common in adults. And it's not always the heel spur that we think about. Some patients, albeit rare, may have a foot fracture, a broken bone, or a bone tumor, God forbid. Rare, we mentioned. But most of the time, people have an inflammation of the muscles on the bottom of the foot, or they can also have an Achilles tendonitis, which causes the heel to hurt. So more often than not, people would usually fall into a few different categories. They may have a job that necessitates their working all day long on their feet, especially on concrete. Or others may have a job where they're literally walking everywhere all day long on cement, on hardwood floors, or even steel floors in different factories. The third group of people would be the people that are overweight because there's more force, more pressure on the foot. And the studies have shown that as someone walks, their weight doubles and triples as a force when it enters the foot. So let's pretend somebody weighs 200 pounds. As they're walking, that weight becomes a force. It enters the foot, and it's roughly between 400 and 600 pounds of force that enters into the foot. And all that hits the heel. So you can imagine that's a lot of force. And the last group that most commonly suffers from heel pain are the people that are flat-footed, because very often the flat-footed nature causes greater strain on the muscles that are in the arch, and that pulls on the heel, and that can cause some pain, like a heel spur problem.
Great, that's fascinating. Do people have people evolved to walk with their heel first? Has that been a natural way that humans have evolved to walk? Is there any other way that people could walk with the ball of their toes hitting the ground first versus their heel?
It's not natural for someone to walk, let's say, let's look at this foot model, like this. Because the bones in the front of the foot are the smallest bones,
Right.
as we can see, because they're all the little toe bones, whereas the heel is the largest and the strongest. So it makes sense that it's the first one that lands when someone is walking. Now, when we look at children, many times we can see them walking on their toes, and that's only a phase. They do that because they're stretching their muscles, they're exercising them, they're pretending they're ballerinas perhaps, even though they may not know what a ballerina is. But at the same time, they're having fun walking on the tips of their toes. And then sooner or later, they get back down to earth and they're walking naturally. So as we walk, the heel is the first thing that hits the ground, and then the foot rolls, and then the heel comes off the ground, and then the toes come off the ground, and the patient continues walking.
So when you multiply that force, that activity over 10,000 steps a day or
Right.
5,000 steps a
Right.
day for people like me, what kinds of problems do podiatrists see that arise out of all those kinds of behaviors that are common?
Well, the heavier the person, the more problems usually, because the force is increased. People who wear shoes tend to have one type of problem. People who don't wear many shoes tend to have other types of problems. When people wear shoes and they do a lot of walking and the shoes are uncomfortable, or should I say too tight, there's a lot of friction on the toes from the leather inside the shoes. So you can develop corns and calluses on the bottom, and the corns are on the top. And those could be quite painful. As we know, a lot of people say, I feel like I have a little pebble in my shoe. And when I look at their foot and I see that they have a deep callus on the bottom, I say to them, you don't have a pebble in your shoe, you have a pebble in your foot. And the pebble is really thick, hard, calloused skin that many times has a deep root. And if the patient walks just right and it hurts them just right, it could be quite uncomfortable. So many times we would see patients with heel pain, arch pain. The athletic patient would have tendinitis, such as Achilles tendinitis or a tendinitis of another part of the foot. They can have a fracture of a foot. They can have a sprained ankle. So we have a combination of problems. The older population would have more arthritis. What does that mean? Crooked toes, toes that are not straight, and those are called hammer toes. Many times they may have a bunion. What's a bunion? A bunion is that bump behind the big toe on the side that's literally sticking out and makes it quite uncomfortable for someone to walk. Other patients may have a dermatitis problem. For example, they can have an irritation of the skin, or they can have an athlete's foot infection that causes the skin to blister and become red. Other patients may have the fungus infection of the toenails that makes the nails ugly and unappealing. So these are many different problems that we see in the office.
Okay, well, we've got our first caller for the night. Go ahead, you're on Feed Forward. How can we help you?
Hi, I want to know, how can you get rid of calluses?
That's a great question, because calluses are caused by friction, and friction is literally the rubbing. And if the callus is on the bottom of the foot, the first thing we tell the patient is make sure it's a callus, because sometimes it could be a plugged sweat gland that's kind of deep and is like a little pebble, or it could be a wart that resembles a callus, because a wart can be a little dry and thickened on the outside. So once you're sure it's a callus, the first thing you do is you examine your shoes to see how much cushioning you have in the shoes. If you have a thick cushioning great. If you don't, you should buy something over the counter and put it in the shoe, something that'll decrease the friction as you're walking and give you a little bit of a bounce as you do walk. And then you want to make sure that you get a pumice stone. Why a pumice stone? Because you use it at the end of the shower when the skin is nice and soft. I remember one of my professors, God rest his soul, if he were alive today, he'd be over 100. This man told us that years and years and years ago, like 80 years ago, the poor people who couldn't afford to go to the doctors would soak their feet for an hour or two in the water, in a pan of water, and then take a butter knife and just shave off the calluses. No problem. And then they'd be fine for a while. So the thing is, if you soak your feet for about an hour, all that dry callus will become very, very soft. And then you could take a butter knife or a pumice stone and just scoop it off, and that'll help a lot. It won't take care of the deep root, but at least it'll give you some comfort. And then if it continues, you'll go to your podiatrist. He'll probably go over what's going on, perhaps take an x-ray and tell you what the cause of it is, and then tell you what's the best form of treatment to care for it.
Thank you for your question. Speaking of home remedies, that's a great one too. Now,
Oh, yes.
is it warts or calluses that people use duct tape on? It's warts, right?
It's warts.
That's a
And I
different
say it
show.
to my patients all the time. They look at me kind of funny when I say duct tape,
Yeah.
but they always have some in the garage or in the
Sure.
basement. So I tell them, look, if you've got a wart, get the wart medicine. Buy it from the store. Use, soak your feet. Use the pumice stone. Get as much of that wart off as possible. Put a little bit of that wart medicine on the acid. Wait about a minute. Let it dry. Then put a piece of duct tape on. Why? Because the duct tape literally seals it, and it seals the medicine on the wart so that slowly, slowly, slowly the wart medicine starts to dissolve and dissolve away the wart. And then when you use the pumice stone, more and more of the wart goes away. Then God willing, in a few weeks' time, most of that wart would be gone. And warts are most common in kids. So we have to watch it, because kids who go to swimming pools, locker rooms at high schools, and walk around in these showers, they can pick up the warts from other students. And they pick them up at the swimming pools because it's always wet around the swimming pool. So other kids with warts can leave the virus there, and then your children can pick it up. So kids most commonly have warts. They could also have ingrown toenails. And a lot of times we see flat feet in kids. And the parents or the grandparents bring them in and say, something's wrong because this foot is straight with an arch and this foot is crooked. Or sometimes both feet are crooked. And when you look at the patient's feet from behind, you can see how there's a little bit of crookedness in the ankles.
Right.
And the kids complain that they don't like running, they don't like playing all these sports which involve running. And the parents say, he sits down all the time during gym, he doesn't like going shopping with me, he complains that his feet hurt or his legs are tired and he wants to sit down all the time. These are signs that the kids usually have flat feet. And when we take the x-rays, we review them with the patients, we tell them what's going on, we can make a pair of specially molded inserts called orthotic devices for the child's feet and shoes specifically, to allow them to walk better, to take the pressure off the arch, straighten up the foot a little bit, and help decrease those symptoms so the patient has less pain. So the whole idea is help these children walk better, help adults who also have flat feet to walk better, and do whatever we can to relieve pain.
That's a great answer. I think that caller got 2 for 1 though on that one. Warts and calluses, so I'm gonna have to charge her extra for that. Getting back to heel pain, plantar fasciitis. Is that still the most common cause or common foot-related, heel-related problem that podiatrists see today?
Yes, it's true. Virtually the vast majority of new patients that I see with heel pain have plantar fasciitis. Now, let's talk a little bit about what that word is.
You've got
what
your
it
model
means.
here. This
I've
is
got my model. I don't leave home without it.
That's right. I keep mine in the back of my seat too, I have to confess.
This is my famous foot model. I use it all the time when I explain things to patients. I love it. The other models I have in the office also show different types of tendons and ligaments and muscles. This one only has bone, and it also has on the bottom the plantar fascia. Now you can see, here's the heel bone, and all this material here is the plantar fascia, which is like a gristle type of material that makes up the arch. And here on the bottom of the heel is where it attaches. Now this is where the people get the heel spurs. This is where the people may have the plantar fasciitis below the heel and under the arch, because as they're walking and standing, all the pressure is in the foot, and it literally begins to injure and inflame and bruise the muscles in the arch and the muscles below the heel. And as they're walking, the damage increases, because every time you take a step, and the average American takes between 8,000 and 10,000 steps a day, you're re-injuring the area and re-injuring it. So what happens is it starts to hurt. And then people say to me, I get out of bed in the morning, I can't step on my heel. I can't step on my foot. I have to walk on one foot, or I have to hop to the bathroom. Other patients say, I sit down to have breakfast. I sit down to have lunch. I get up from the table. I can't step on my heel. Or I get out of the car after a half-hour, 1-hour drive. I can't step on it. Why? They say to me, I feel as if I have a needle or perhaps even a nail poking through the bottom of my heel, because all this area is inflamed and sore. And when you're sleeping in bed, the muscles shrink, and then when you go to step on it, you pull it and you tear it and you re-injure it, and that's why it hurts a lot. So the whole idea is to get these people into the office, help them, because what happens is they have shown that people who have plantar fasciitis in one foot, after about 6-7 months, start to get it in the other foot because they're putting all the weight on the other foot,
Right.
so that the painful foot doesn't hurt as much.
That's interesting. I was at a party on Saturday night, and there was some women talking, and one of the women had been recently pregnant, and she said that she thought, or her friend said, that her foot problems were not related to her pregnancy. And I said, no, I think they are, because when you're pregnant, your limbs loosen up, and that affects your feet too. Is that a myth too that I've been fed at these cocktail parties that I am forced to attend, or is it true?
Okay, that's a great question, because my wife just delivered. We have our first baby about 5 months ago.
Congratulations.
Thank you very much. So Maximus is his name, and he's 5.5 months old.
Now say his name, Maximus.
Alexoplous.
Alexoplous.
Now, is that a mouthful or what?
That is a mouthful.
Great. Beautiful little baby. And my wife started getting plantar fasciitis during her pregnancy.
Right.
Why? Because she started gaining all this weight.
That's it?
That's it. But the thing is, she gained weight quickly, as most women do during their pregnancy. Usually we gain weight slowly. So the feet adapt, the muscles stretch.
Right.
But with pregnancy, two things happen. One, the woman gains weight quickly.
Right.
And two, the hormonal changes in the body allow for the ligaments to become a little bit more relaxed. Now, the ligaments hold the bones together. So why do we have hormones released in the woman's body during pregnancy, especially towards the end of pregnancy? It's because we want to relax the ligaments so that in the pelvis it can stretch a little bit to allow the baby's head to pass through. Now, since the ligaments are throughout the body, not only are the ligaments in the pelvis relaxed and allowed to stretch, but so are the ligaments that are in the feet. So since the ligaments are relaxed that hold the bones together, the foot becomes a little bit weaker, let's say. And as the patient steps on the foot, there's less support, less strength, and there's more stretching and more pulling, and that's when all the bottom here, the plantar fascia, starts to get sore because the ligaments aren't doing their job fully. And with the added weight, and we talked about the force a few minutes ago, it leads to plantar fasciitis. Thank God, more often than not, it decreases and goes away after birth, but not always. Sometimes the damage is so bad it sticks around. That's why I always tell all my patients who are pregnant to make sure we give them some type of a temporary insole orthotic device to wear in their shoes before it starts. That way they cruise through the pregnancy, and then if they want to continue, because they end up loving these insoles in their shoes, wearing them after pregnancy, they may or they may discontinue. But the whole idea is prevention is worth a pound of cure.
That's what I told this woman too, and she looked at me like I was crazy. But what do I know? I'm just the host of Feed Forward. So you mentioned orthotics, which is a great segue into your second half of what we wanted to talk about. And probably a lot of people that come in with plantar fasciitis end up getting a custom-made orthotic. So tell us a little bit about what they are, how they are fashioned or created, and what role they play in causing or healing these problems.
Beautiful. Very important, because when it comes to plantar fasciitis, when it comes to heel pain, when it comes to arch pain, the whole idea is to prevent surgery. We want to prevent surgery because I don't know anybody who wants to have surgery unnecessarily. So 95% of the time we can prevent surgery in patients with plantar fasciitis. How do we do it? We do it through a combination of treatments. We use physical therapy, we use stretching, we use massage therapy, we use taping and strapping of the foot, we use the orthoses, we use ice therapy. Sometimes we give them a shot, but we don't like to do that either. Rarely do we give them any medicine to take because it masks the pain. It doesn't treat the problem. Because don't forget, this is a mechanical problem, Chris. If you walk on it, it hurts. If you don't walk on it, it doesn't hurt. So I have these orthoses that I brought from the office. There's different ones that we use. This is one. This is one we would use in different types of athletic shoes or roomier shoes. This is a different one, which is thinner and shorter. This kind I would use in more of a dressy shoe that allows for less bulk. So what happens is when we make this for the patient, we take a mold of the patient's foot, an impression, so to speak. It takes about 5-6 minutes to take the impression. Usually we use plaster of Paris or some other material. And then we take off this little cast. It takes 5-6 minutes. The next day we send it to the laboratory and they make for us this custom molded shoe insert known as an orthotic device that the patient would wear in their shoe. And what this does is it improves the function of the foot. It decreases the pressure in the arch, takes a lot of the tension off of these muscles, protects the heel, and allows the patient to walk without pain. And that's the whole idea. And you know, people look at me funny when I hold this up. They can't figure out how something with a little plastic here, a little cushion here, can literally help them avoid surgery. But it does. And then they end up coming back and say, Doc, can you make me another pair for my dress shoes? Or can you make me one for my gym shoes? Because I love them so much. The whole idea is to help eliminate pain, restore function, and help keep the patient out of the operating room as much as possible.
So do you typically need a different orthotic for different shoe, like my running shoe, my work shoe, my construction boot, my ski boot, whatever?
Usually for men, because men wear roomier shoes, we just make one pair of an orthotic device.
Just slip them in,
slip them out. Now with women, we would make it for the shoe they wear most of the time. So let's say a woman wears dress flats all the time and doesn't wear gym shoes that often.
Wait, there's a woman that wears one pair of shoes all the time?
Dress flats.
Oh, okay.
Different styles, but dress flats, okay? We would make this version. And I'm glad you mentioned that because I want to talk to you about heels also. We would make this for them to wear in their dress flats. They can slip in and out. And you can even put this in your gym shoe. And then a lot of times women say, can I have the other one for the gym shoe also? Can we make that? And since the laboratory always saves the molds digitally, they just make another pair for the patient. Now, about heels, I should mention that when women wear a little bit of a heel, they always say to me, my foot doesn't hurt me when I wear my high heels. How come? And they're perplexed because they always hear doctors telling them don't wear high heels.
Right, yeah.
And the truth is, when you have a high-heeled shoe, watch what happens. Your heel is literally off the ground, okay?
Sure.
So all the pressure's in the front of the foot, so there's very little pressure in the heel, and that's why it feels better and it doesn't hurt as much.
So that walking mechanism has been changed, so the
Correct.
heel doesn't strike
as much with as much force. Now the force is transmitted to the front of the foot. There's less force in the heel, and that's why the heel does not hurt as much. And that's why we encourage the patient to have a little bit of a heel when they have the symptoms, so that it slowly decreases. Plus with the stretching we teach them and all the other things that we teach them to do, the whole idea is to get the patient feeling better. And the thing is, I love putting tape on my patient's feet, athletic taping, because I had my feet taped many years ago. And I should mention, the reason I got into podiatry, I had plantar fasciitis myself on both feet. So both of my arches were killing because I'm flat as a pancake. My brother too. We're both flat and we both have orthoses in our shoes. I have two pairs, one for my dress shoes, one for my athletic shoes. And I had my feet taped up all the time, and I loved it because it made the pain go away.
Yeah.
And it decreased the pain phenomenally. So I always tape up all my patients, and then we get them into a pair of temporary insoles, then we get them into the real insoles, the real orthotics, and then they have those for years, and they love them because the whole idea is to get rid of the pain and restore the function.
When you send a patient home with a diagnosis of plantar fasciitis, what kind of home care instructions do you usually tell them to follow?
Okay, the first thing I do is I tell them, if you have a golf ball, and if you don't have a golf ball, we have something similar to a golf ball in the office. Take it, put it on the carpeting, and just massage your heel and your arch back and forth over it. Now, as the foot is going back and forth over the ball, it's massaging. Deep massage to the muscles and deep massage to the muscle below the heel. And that'll help calm it down. And then I say to them, go in the kitchen and open the freezer where you would have placed earlier in the day a can of soup. Take off that paper label because you don't want anybody eating that soup, and take that frozen can of soup, put it on the carpeting or on the floor, and wear a thin sock. And then run your foot back and forth over the can, because that's going to help calm down the inflammation, and then do some different stretching to stretch the muscles of the calf and also massage the muscles of the calf so it'll all calm down and help you get better.
That's actually pretty good advice, even if you don't have plantar fasciitis. That golf ball thing, that feels pretty good.
People love it.
On any day, especially if I've been shopping all day and walking my 10,000 steps like I want to do. Well, thank you for coming today. This has been one of the the best shows we've had in a while. For those of you who have watched, if you do not have a podiatrist you're seeing regularly, you can visit our website at ipma.net. click on the physician finder, type in your zip code, and you'll get 3 or 4 podiatrists probably within your neighborhood that you can go see. They're all IPMA members, and they're well qualified to take care of whatever's ailing you. Thank you for coming, Dr. Alexoplous.
Thank you for having me, Chris, and please don't hesitate. Call your local podiatrist. Go in and see him because foot pain is not normal. Take care of your feet. They should last a lifetime.
Okay, we'll see you next month. Thanks.
Thank you.